we're going to start Chapter 14, Personality. Now for this chapter, we're going to break it down into a bunch of different perspectives and theories based on how they view personality. And we're going to start off with the psychodynamic perspective. But before we start talking specifically about the psychodynamic perspective, we should probably take a moment to talk about what personality actually is. People all act differently. We're all unique in how we react and interact with our environments. Psychologists who focus on personality are going to be studying individual differences. Whereas a lot of other research that we've looked at so far tries to control for individual differences to get a feel for some measure of the population. But personality goes the other way. Now we care about those individual differences. Within those personal differences, we see that people behave at least somewhat consistently over time and across different situations, which gives us sort of this general idea of personality traits that are consistent ways that we respond to different stimuli. We've already discussed the fact that there's somewhat moderate stability in personality from childhood to adulthood. You may remember that there's some consistency, but only in extreme cases. But that consistency tends to increase over time. So once you're into adulthood, your adult personality tends to be fairly stable. So we can start putting together this idea of individual differences and consistency across time into a definition of personality, which leads us to this idea of personality as the sort of distinctive and relatively enduring ways of thinking, feeling, and acting that characterize a person's response to situations. For a way of thinking, feeling, and acting to be typical of our personality, it should have these three different qualities. They should be seen as components of identity, things that distinguish you from other people. So you are distinctive and individual and not like anyone else. The second thing is that these behaviors should be viewed as being caused primarily by internal rather than external or environmental factors. So it's caused internally, it's inside of you, it's not your environment. This is something driven by you yourself internally. And the last thing is that these behaviors should fit together. They should be organized in some meaningful fashion. So there should be some kind of inner personality that's guiding and directing your behavior. There's some kind of meaning here. And we can see this all put together in this diagram from the textbook. So behaviors that are typical of our identity, that are internally driven and have this organized structure can be attributed to our personality. And how we consider all of these components and how things all work together to form our personality is going to depend on your perspective. So if you remember back to Psych 104, when you learned about all the different perspectives of psychology, where it's a matter of how you consider the information that you're given. So it's not that any one perspective is going to be better, it's just that it looks at the information that's present from a particular angle, from a specific perspective, and then allows us to get at different information. So don't think of the perspectives as sort of contradictory and mutually exclusive, only one can be correct kind of situations, but think of them as just different angles to consider the same problem, different angles to look at personality. So we're going to talk through a bunch of these different perspectives and how they look at personality, starting with the psychodynamic perspective. Now for the psychodynamic perspective, the theorists that we're going to talk about primarily look for the causes of our behavior in terms of a dynamic interplay of inner forces, and they're often going to focus on the fact that there's conflict between these inner forces, and that's what's driving our behavior. And so whenever you hear psychodynamic, At this point in your psychology careers, you should automatically think Freud, because Freud was the pioneer of the psychodynamic perspective. So Sigmund Freud proposed the first and most influential psychodynamic theory called the psychoanalytic theory. And I want to preface this with sort of a disclaimer that while we talk a lot about Freud, and most of this video is going to be about Freud is one of those cases where his theories were very extreme and weird. And we talk about them now not because we think that they're 100% accurate, but because they served to get other people thinking and talking and theorizing in the field. So they were very influential and led to a lot of modern thinking about personality. So take all of the stuff about Freud with a little bit of a grain of salt, because, as I said, it's a little bit weird. Now, this whole psychoanalytic theory came about because Freud went to study with a French neurologist named Jean Charcot. Charcot. I can never pronounce that one right. And Charcot was researching conversion hysteria, which is a strange situation where physical symptoms, things like blindness or paralysis, would appear suddenly and have no apparent physical cause. So the idea was that this was happening because of some kind of unconscious aspect of the mind. So Freud was convinced that this conversion hysteria was being driven by painful, repressed memories. Freud assumed that these repressed memories were often sexual or aggressive in nature, and by allowing these patients to re-experience those traumatic memories or express those inappropriate feelings, their symptoms would start to improve. Despite criticism, Freud continued to build up this psychoanalytic theory using techniques like hypnosis, free association, and even dream analysis in his attempt to access the unconscious mind. And this theory grew to become a theory of personality, a means for studying the mind and even treating psychological disorders. So let's talk about the specifics of this psychoanalytic theory. Freud seems to have been influenced by hydraulic models of physics that were common at the time when he was coming up with this theory. And those hydraulic models were based around the idea of exchanges and releases of energy. So Freud considered personality to be an energy system. Freud stated that our instinctual drives would create something called psychic energy, and this psychic energy would power the mind and push us for either direct or indirect release. So if we had a buildup of sexual energy, it could be directly discharged as sexual activity or indirectly discharged as sexual fantasies, or something like painting. Lots of diverse outputs for the indirect release. Freud also drew a distinction between three different categories of mental events. We have our conscious, the things that we're actively aware of. So maybe you can be actively aware of the fact that I'm speaking, that you're listening to what I'm saying. Our preconscious is something that you're unaware of at the moment, but could be easily recalled. So if I asked you to think about what you had for dinner yesterday, or if I asked you what you did for your 16th birthday, you might be able to recall those pieces of information from your preconscious and bring them into your conscious awareness. And the last part is our unconscious. And this is the stuff that we're not aware of. Our wishes, impulses, and drives. All the stuff that Freud focused very heavily on. Now we see the conscious and the preconscious fairly often. So we might assume that they make up a large portion of our mind. But Freud would argue that the unconscious is the bulk of our mind, and specifically the most important part of our mind. And we can only see that hidden part when those impulses he talked about are discharged in some sort of way. So we could see the unconscious in our dreams, in a slip of the tongue, and other kinds of disguised behavior. Now, this figure shows us a fairly well-known imagination of Freud's theory here, where the conscious is the section of an iceberg that sticks out of the water. It's the small portion that's visible, whereas the preconscious and unconscious are the bulk of the iceberg that's hidden below the surface. Now, this image is also going to include what we're going to talk about next, which are three separate but interacting structures that Freud described to divide up our personality, talking about our id, our ego, and our superego, and all the roles that they took for personality. We're going to start at the bottom here with the id. And the id exists totally within the unconscious mind. It's the innermost core of the personality, and it would be the only structure that Freud thought was present at birth. So this is going to be the source of all of our psychic energy that drives this psychoanalytic theory. So the id has no direct contact with reality and would then function in a totally irrational manner. It's all contained within our unconscious, and this is what's driving all of those urges and impulses that Freud likes to talk about so much. So Freud said that the id would operate according to what he called the pleasure principle. And this principle says that you would seek immediate gratification or release. You would want to act immediately on those urges, on those desires that you have unconsciously. And this drive to act would happen regardless of rational considerations and environmental realities, because the id is separate from our environment and it doesn't have any rational rules governing it. So according to this pleasure principle, if you want something, you just take it, which might explain some of the behavior that you see in young children, where if they want something, they reach out and they take it. There's no impulse control. And that was sort of what helped drive the start of the id being the only structure present when we're young. But if the id has no contact with the outer world, it can't directly satisfy itself by obtaining what it needs from that environment. So over the course of development, new structures start developing to allow that interaction to happen. And the next of these structures to develop would be the ego. So the ego functions primarily at a conscious level. So if we scroll back to our image here, the ego is covering the conscious. But it's also going to bridge that gap between the unconscious and the conscious. So it's going to function mainly to keep the impulses of the id under control. So our ego is going to try and delay gratification. It's going to watch our environment and see when it's safe to act on those impulses. So the ego gives us some form of self-control. And it's going to operate according to a reality principle. So it's going to test our reality, our environment, to decide when and under what conditions the id can safely discharge that psychic energy, those impulses it has, in order to satisfy its needs. So if you're having a buildup of sexual energy, maybe it's going to find a hobby that allows you to discharge that tension. Or maybe you're going to go find your partner. Some way of discharging those urges and impulses in a way that fits with your current environment. The last of the structures to develop is the superego. And this is going to be where our morality comes from. The superego is thought to control the impulses of the id, at least at first, with external control. So from feedback from your environment, you know what is right and what is wrong. And so Freud thought that our superego would develop by the age of 4 or 5, and up to that point, we would start building up these ideas, these values from society. So as a child, you observe your parents and how they're acting, and you can be taught directly what is right and what is wrong. And so from your external environment, you are rewarded for doing good things, things that are right, and you are punished for doing things that are wrong. And as your superego develops, you develop your own form of self-control. So it doesn't have to just be external control from reward and punishment. You could actually start controlling yourself through the superego. And so where the ego would try and delay gratification until it's safe to act on those impulses, the superego tries to permanently block gratification, exerting sort of total self-control. So these moralistic goals that you develop can actually start taking precedence over realistic ones, regardless of the cost. So you can internalize this idea of morality, of what is right and what is wrong, and sometimes that ends up removed from the reality of the situation. The textbook uses the example of maybe if you were raised in a really religious family, you were raised with the idea that sex is wrong. And some people, even when they get married, still have that internalized idea that sex is wrong. And even sex within a marriage starts to feel wrong because of that internalized moral. So that would be a case where the superego has taken precedence over the realistic situation where within marriage, sex should no longer be considered wrong. But sometimes there's a cost associated there, and those internalized morals can take over. So with all that groundwork set, how does this start relating to personality? So Freud said that personality is going to be made up of a dynamic struggle between our id trying to discharge those instinctive energies, our psychic energies, and the opposing forces that are generated by our ego and superego trying to either reroute those energies or completely control those energies. And sometimes our ego can't always control the id, leading to conflict. And so we can have anxiety when the impulses of the id threaten to get out of control. So that anxiety acts kind of like a signal, the way that physical pain would, to warn us of danger, motivate us or motivate our ego to start dealing with the problem of our out of control id. And we can reduce that anxiety through some realistic coping behaviors. So maybe if you have a buildup of anger, maybe you could sit down and have a discussion to dissipate that anger through a realistic coping mechanism of talking about it. Or the ego might resort to defense mechanisms. So if those realistic coping behaviors aren't helping or aren't being used, defense mechanisms can come into place. And defense mechanisms are considered a weapon of the ego. And they're basically distortions of reality. So instead of a healthy coping mechanism, it's going to be a skewing of your own perception. And they often operate unconsciously and can lead to maladaptive behavior. So things like repression, denial, displacement, projection, and so on are all types of defense mechanisms. And they're not necessarily a healthy way to deal with that buildup of psychic energy, though they do, in the short term at least, help alleviate anxiety. Though it can lead to longer term problems because you're not actually getting rid of the anxiety, you're just putting it elsewhere. Now, if that part of Freud's theory wasn't weird enough, we're going to start talking about another aspect called psychosexual development. And so Freud was convinced that a lot of our personality was molded by early life experiences. So he dealt a lot with people's childhood and things that they dealt with during their childhood. So Freud proposed that children pass through a series of psychosexual stages during which the id's pleasure-seeking tendencies would be focused on specific pleasure-sensitive areas of the body, called erogenous zones. Now, if we hop to the next slide, we can take a look at these different stages that he pointed out. Stages including our oral, anal, phallic, latency, genital stages, where the erogenous zones correspond to the stages, and we progress through them from the age, from birth all the way up to puberty. And so each of these stages has a key task that's associated with the particular erogenous zone. So during the oral stage right after birth, so from the age of 0 to 2, your erogenous zone focused on the mouth, and the key task is weaning, so breastfeeding and then stopping breastfeeding. And I did warn you that this was a weird one. But Freud said that our adult personality would be a function of our progress through these different stages. And if we had inadequate or excessive gratification at any of those stages, it could lead to fixation. So we would have arrested development where our interests would focus on a particular area. And because these are all erogenous zones, areas that we shouldn't, according to society, be focusing on, it could lead to problems in terms of our personality. For obvious reasons, Freud's psychoanalytic theory was very controversial, even when it first came out. Most theorists rejected the idea of childhood sexuality. There is some agreement that childhood experiences like emotional attachments can influence our personal development and our personality development, but there isn't a whole lot of support for Freud's specific stages. So why do we talk about this? And it's because this got the field started. It got people talking about personality and what might be driving our personality. While he was trying to gather evidence for his theory, Freud was pretty set against the idea of experimental research. He thought that a lot of these complex phenomena couldn't really be observed under controlled conditions because you would lose some of that complexity. And that's kind of supported by people who look at the psychodynamic perspective today, but mostly because it's actually difficult to study these kinds of situations in the lab. It's a lot easier to use a clinical setting or an observational setting where you can witness the effects of different aspects of personality. It's very hard to manipulate and control personality. So if we want to critically evaluate the psychoanalytic theory, we can come up with quite a few shortcomings. In addition to the bizarreness of some of the statements, it's actually very difficult to test a lot of the aspects of this theory. It's hard to tell if you're seeing genuine results or if it's the result of some kind of defense mechanism. A lot of these concepts are really ambiguous and really hard to evaluate. For example, how would you operationally define and measure something like id impulses? It's pretty hard. So even though today there is still some research that falls within this psychodynamic theory, there's not a whole lot left. We still see things like free association, discussion of defense mechanisms, and even repression still being studied today, but a lot of the specifics related to Freud and his theories, not so much. I guess the closest we come is the idea of unconscious processes still having a very strong component of our personality. We do see some evidence for that, especially in terms of, say, the cognitive perspective. We have ways of measuring what's going on in the brain. We can see brain activity as we do different actions. And there is evidence that there's a lot of unconscious or non-conscious processes. A lot of our brain sort of runs itself. Things like breathing and digesting, those things happen in the background. And we can even have things that we are registering in our brain, but we aren't consciously aware of. Things like subliminal messages or even non-relevant information that we filter out by not paying attention to it. So the idea of our unconscious having an effect on our personality isn't completely far-fetched. let's continue not talking about Freud. So, like I said, Freud was very controversial, and even people who thought fairly similar to him didn't necessarily agree with all of his ideas and all of his theories. So we can start talking about the Neoanalysts, people who were psychoanalysts but disagreed with different aspects of Freud's thinking. They would make up their own theories. These neo-analysts wanted Freud to pay more attention to things like social and cultural factors and less attention to things like child sexuality and the childhood influence on adult personality. They basically wanted a more balanced view of personality. And so mostly they could agree that humans were social creatures motivated by social interest, a desire to advance the welfare of others. So Neoanalytics, like Adler, said that we would place social welfare above personal interests. We would cooperate with others and care for others. And this was pretty different from Freud's view of people as sort of savage animals caged by civilization and driven by their urges. There was a little bit more cooperation and socialness brought into these neo-analytic approaches. Though Adler added a layer where he said that people were striving for superiority, where we could have inferiority complexes, where we were trying to compensate for either real or imagined defects. So we'd try and become more competent. We'd try to overcome our obstacles and be the best person that we could be, to become a superior being. And that kind of sounds a little bit like some of the humanistic approaches we'll talk about later on in this chapter. But the last aspect of the psychodynamic perspective that we're going to talk about are the object relations approaches. And these object relation theorists came into prominence shortly after Freud's death. And these theorists focused on the mental representations that people form of themselves. So basically, how do people think of themselves? How do they view themselves and others? And so these focuses became working models to try and interpret social interactions. So we could have these mental representations, and these representations could be either real or distorted, but they would become lenses through which we would interpret our interactions with others. So if you're someone who interprets things negatively, you might start viewing things negatively, which can generate self-fulfilling prophecies, which we've talked about a couple of times in this course now, where if you assume the worst in people, sometimes you can bring out the worst in people. And these object relation theorists also ended up overlapping a little bit with something we've talked about previously in the course, which are attachment styles. So some of them thought that our attachment styles when we were younger could color our adult relationships. So whether we had a secure versus avoidant versus anxious, ambivalent attachment style would influence how we interacted with the world as adults. So that was the progression of this psychodynamic perspective.